Welcome to Talk 5, the most practically oriented talk in the series. We're going to survey the most common real-world toxicants across three environments: the home, the farm and garden, and the landscape. This isn't memorization. We're going to organize these toxins by the clinical syndromes they cause so you can recognize them in practice. Think of this as building your mental Rolodex of the most likely toxicologic emergencies you'll encounter in clinical practice. Ground ourselves in the real world. The ASPCA Animal Poison Control Center handles over 400,000 cases per year. They publish annual data on the most common exposure categories. The number one category is over-the-counter human medications. This is largely driven by owners trying to treat their pets at home with human products: ibuprofen, acetaminophen, and cold medications. These cause serious and sometimes fatal toxicosis. Number two is prescription medications. Again, usually human drugs, whether the pet ingested them accidentally or an owner deliberately administered them. Food items: xylitol, grapes, raisins, onions, chocolate, macadamia nuts are consistently high on the list. Veterinary products in the top 10 might seem surprising, but remember, dosing errors, wrong species administration, and compounded products all contribute. Insecticides, particularly organophosphates, pyrethrins, and spot-on products, remain a major concern. Rodenticides are particularly dangerous because the long-acting anticoagulant products cause a syndrome that doesn't manifest for 2 to 5 days after ingestion. By the time the animal is bleeding, coagulation stores are depleted. Cannabis exposures have risen sharply in states with legalization, especially edibles, which are often highly palatable and high potency. The takeaway from this slide: when you take a history on a toxic exposure, ask about everything in the house: human medications, food items, garden products. Don't anchor on one thing. Through the household toxins. These are the ones you need to know cold because clients will call you about them constantly. Chocolate and caffeine. Theobromine and caffeine are methylxanthines. They inhibit phosphodiesterase and block adenosine receptors, leading to CNS and cardiovascular stimulation. The darker the chocolate, the more theobromine per gram. White chocolate has almost none. Baking chocolate is the most dangerous. The toxic dose of theobromine is approximately 20 milligrams per kilogram for mild signs, over 40 milligrams to kilogram for cardiac signs. Knowing the chocolate type and approximate amount helps calculate the risk. Xylitol. We've covered this in detail in talks 2 and 3. Key point here: check ingredient labels. Xylitol is increasingly being added to products marketed as, quote, natural or, quote, sugar-free. Peanut butters are a particularly important one because people deliberately give peanut butter to dogs as a treat or to administer medications. Grapes and raisins. The frustrating reality is that some dogs eat grapes regularly with no apparent effect, while others develop fatal AKI after a single small serving. We cannot predict which dogs are susceptible. The current leading hypothesis is tartaric acid, which is particularly high in grapes, but this hasn't been definitively proven. Given the idiosyncratic nature and the severity of the outcome, the standard of care is to treat any grape or raisin ingestion as a potential emergency. Onion and garlic. The thiosulfate compounds, specifically N-propyl disulfide, oxidize hemoglobin and cause Heinz body hemolytic anemia. Cats are 2 to 3 times more sensitive than dogs. Even small amounts of garlic can be toxic to cats, which is relevant given some cat food formulations that contain garlic flavor. Onset can be delayed 3 to 5 days. Human NSAIDs. Ibuprofen in particular is enormously problematic. Clients think it's just an ibuprofen. In a 5-kilogram cat, a single standard tablet can cause fatal GI hemorrhage or renal failure. Dogs can tolerate slightly more, but the therapeutic window is still very narrow. Macadamia nuts. This is genuinely a mystery toxin. The mechanism is completely unknown. The syndrome is remarkably consistent. Weakness, hyperthermia, tremors, but typically self-limiting. Good news. No reported fatalities from macadamia nuts alone. Cultural and garden toxins are a major category in both small animal and large animal practice. Rodenticides deserve special attention because they're extremely common and frequently misidentified. First generation anticoagulant rodenticides, warfarin-based, are largely obsolete because rodent populations developed resistance. The second generation compounds, like budificum and bromadiolone, are much more potent and incredibly long-acting. A single dose has a biological half-life of weeks. The delay to clinical signs, 2 to 5 days, is critically important. By the time you see a dog bleeding spontaneously, it's already in trouble. Treatment is oral vitamin K1 for 4 to 6 weeks for brodificum. Check PTT 2 days after stopping to confirm adequacy. Bromethalin is a completely different rodenticide, a neurotoxin that causes cerebral edema. Signs are neurological: tremors, paralysis, depression. There is no antidote. This is why rodenticide identification is critical before treatment. You need to know if you're dealing with an anticoagulant or a neurotoxin. Treatment is completely different. Mannitol and corticosteroids for cerebral edema versus vitamin K for anticoagulants. Zinc phosphide, used in mole and gopher bait and increasingly in large-scale rodent control. When ingested, it reacts with gastric acid to produce phosphine gas, the same substance used as a fumigant. Phosphine is a mitochondrial toxin. Critically, the vomitus of an animal that has ingested zinc phosphide releases phosphine gas. It's a hazmat risk to veterinary staff. Induce emesis outdoors in a well-ventilated area away from people. Contact the ASPCA APCC. Organophosphate and carbamate pesticides, these are common in agricultural settings. Exposure can be dermal, oral, or inhalational. Know the slud toxidrome and treat accordingly. On glyphosate. There's been a lot of public attention on this herbicide. The clinical reality is that most small animal glyphosate toxicoses are mild irritation, driven by surfactants in the formulation, not the herbicide itself. Supportive care is usually adequate. Plants are one of the most common exposure categories, partly because they're everywhere and partly because they're so diverse. The organizational challenge is that there are thousands of potentially toxic plants, so let's organize them by what they do. The most dangerous plant toxicoses are cardiac and renal because those cause rapid, life-threatening organ failure. Cardiac plants, oleander, foxglove, lily of the valley, and yew, taxa species, all contain cardiac glycosides or related compounds that disrupt sodium potassium ATPase. Even small amounts, a few leaves of oleander, water contaminated by oleander leaves, can be fatal. Yew is particularly dangerous because the red berries are attractive and the toxin, taxine, causes rapid cardiac arrest. Renal plants in cats, Lilium and Hemerocallis. We covered these in Talk 3. The critical clinical point remains any cat plus any lily plus any amount equals hospitalized immediately. Hepatic plants. Sago palm cycad is critically important in the southern U.S. and as a houseplant. It contains psychocin, which is metabolized by gut bacteria to methyl azoxymethanol, a potent hepatotoxin. The fatality rate is high even with aggressive treatment. Early aggressive decontamination and N-acetylcysteine are the best interventions. Neurotoxic plants. Water hemlock, cicuta, is one of the most acutely toxic plants in North America. Cicutoxin causes violent seizures. Jimson weed causes the anticholinergic syndrome. Cannabis causes CNS depression. Black nightshade has alkaloids with varying effects. GI irritant plants. These are the ones that generate the most panicked calls but are often the least dangerous. Poinsettia, the holiday plant, causes oral irritation and GI upset but is not the deadly plant it's rumored to be. Dieffenbachia contains calcium oxalate crystals that cause intense oral pain and swelling, but rarely systemic toxicity. Post philodendron, similar. The key message: triage your concern based on what system the plant affects. GI irritant equals support and monitor. Cardiac, renal, immediate emergency management. Animal toxicology has some unique features: the scale of exposure, a whole herd can be affected, the economics involved, and the fact that plant toxins from forages are a major category. Nitrate toxicosis in cattle is a great example. Certain forages, particularly Sudan grass hybrids, drought-stressed corn, and some weeds, accumulate nitrate. Rumen bacteria convert nitrate to nitrite, which is absorbed and oxidizes hemoglobin to methemoglobin. The blood turns chocolate brown. Affected animals show exercise intolerance, dyspnea, and cyanosis. Treatment: methylene blue, which acts as an electron carrier to reduce methemoglobin back to hemoglobin. Cattle respond well if treated early. Cyanogenic glycosides. The mechanism is fundamentally different from nitrate, but the presentation overlaps. HCN blocks cytochrome C oxidase, causing histotoxic hypoxia. Paradoxically, the venous blood is bright red because the cells can't extract and use the oxygen. The tissues are hypoxic despite normal oxygen delivery. Treatment: the nitrite thiosulfate combination. Nitrite creates methemoglobin, which preferentially scavenges cyanide. Thiosulfate provides a sulfur substrate to convert cyanide to the less toxic thiocyanate. Mycotoxins in feeds are a major agricultural toxicology issue. Fumonisin B1 is the cause of equine leukoencephalomalacia, a devastating brain softening syndrome in horses and donkeys. Aflatoxin causes hepatotoxicity across species. Ergot causes peripheral vasoconstriction, leading to dry gangrene of the extremities. Tall fescue toxicosis. This is endemic in the southeastern U.S. The endophyte lives inside fescue grass and produces ergot alkaloids. Cattle on infected pastures show poor weight gain, heat intolerance, reproductive problems, and in severe cases, fescue foot, dry gangrene of the distal limbs from vasoconstriction. Urea toxicosis is entirely preventable but still occurs, usually when cattle are introduced to urea-containing supplements abruptly or when the supplement mixing ratio is wrong. Rumen bacteria generate ammonia so rapidly that the liver can't keep up. Treatment is dilute acetic acid, vinegar, Puros. The acid shifts rumen pH to suppress urease activity.